Well, friends, welcome to today's webinar. And today, Dr. Gurudas Khilna is the speaker. He's speaking on operational interdisciplinary rearrangements of competencies of pharmacology curriculum. Over to you, sir.
Good evening, everyone. Am I audible?
Yes, sir.
Okay. Then, in order to prepare SLOs, taking consideration of each competency, I thought it is better to understand and group the competencies so that redundancy is reduced and number of SLOs would be less. So it will be more informative. This short session would be on the competencies which are similar in nature and can be clubbed together. Conversely, there will be few competencies which are actually larger one, and they must be divided, broken into sub-competencies or components for which SLOs should be made. So I will just finish up this introduction shortly. Now let us look at the first slide, PH 1.3. Enumerate and identify drug formulations, drug delivery systems, whereas PH 1.59 is fixed dose combinations apart from other components in this PH competency. Then there is another one, PH 2.1, demonstrate understanding of use of various dosage forms. So there are actually three sub-competencies or components in different competencies, and domain and level is SH, KH, and SH. Therefore, while preparing the SLOs, common SLOs can be prepared for these three. This will reduce the number of SLOs and less work will be required. Similarly, PH 1.6 define, identify, and describe ADR. PH 1.7 pharmacovigilance and ADR reporting system. And finally, PS 3.4 recognize and report ADR. So accept that 3.4 is shows how it has to be in the skill section. The SLOs can be prepared entirely for these three competencies together. Another example is PH 1.10, describe parts of correct generic prescription, errors and corrections, shows how, and PH 3.1, which is write a rational, correct, legible generic prescription for a given condition. This is performance level, it has to be done repeatedly. So, however, the SLOs can be prepared together. PH 1.11, rules of administration, PH 4.1, various routes in a simulated environment. Obviously, it is better to take a class, small group discussion, then followed by a skill session or simulation. Obviously, SLOs will be accordingly. Describe and discuss genomics and pharmacoeconomics. Now here pharmacoeconomics is in 1.6, and again there is some cost relationship with the drug treatment in PH 5.4. So for these two, sub-competencies can be developed and components, that is SLOs, can also be developed in common parlance. PH 1.63, drug regulation, acts and legal aspects, and PH 5.7, legal and ethical aspects of prescribing. I think very closely related. Of course, one can take the help of FMT also. It can be aligned or integrated, shared session, but it will be better to prepare SLOs in these two competencies together. It will save time. PS 3.3 and 3.6 perform a critical evaluation of drug promotional literature, again an interaction with the pharmaceutical representative. So they are more or less related. Therefore, these two would have common or consequential SLOs, and both are in the skill session. Many examples are there. For example, PH 5.6 and PH 1.59, where common is OTC drugs. Then PH 1.59 and PH 3.7, common is essential medicine. PH 1.37 And pH 1.39 common is contraceptives, contraceptions, and sex hormones. Obviously, unnecessary duplication would be done if SLOs are prepared separately. They must be aligned. If not aligned, a common SLO should be formed. pH 1.20 and pH 1.21. Ethanol, acute and chronic effects, and again management of methanol and ethanol poisoning. Obviously, once symptoms, effects are discussed, management will be thereafter. Therefore, common SLOs should be prepared. pH 1.22, 1.23, drug dependence and mechanism of drug process and mechanism of drug de-addiction. pH 5.6 and 5.5, educate public, demonstrate ability to educate public and patient about various aspects of drug use, including dependence and OTC drugs. There's a lot of the overlap, but this can be clubbed with demonstrate an understanding of caution in prescribing drugs likely to produce dependence. And one is in shows how, another is in knows how. Therefore, 5.5 SLOs followed by 5.6 SLOs, but common would be there. pH 1.4 describe absorption distribution. Sorry. So this is all about what I call it as intradisciplinary alignment. That you have to club the common competencies to prepare common SLOs, so that time is saved, redundancy is decreased, and there is a better understanding of the subject. Now, conversely, there are some competencies which require breakup into sub-competencies or components. And some of the examples which I found: absorption, distribution, metabolism, and excretion. Entire pharmacokinetics is 1.4. It cannot be taken in one lecture or two lectures. There has to be division. It depends upon how you divide and develop SLOs. Similarly, pH 1.13, mechanism of action, types, doses, side effects, indications, contraindication, adrenergic drugs and anti-adrenergic drugs. So there are actually two chapters given together, but the theme is common. Adrenergic is the theme. Therefore, I would prefer to divide it into two components and develop SLOs accordingly. 1.14 for cholinergic and anticholinergic drugs. Theme is cholinergic or parasympathomymetic system, but they can be divided into two groups and SLOs prepared accordingly because indications have to be different. Although theme is same. pH 1.16. So many autocoids are included in one competency, very big actually. Now look at the way NSAIDs are used today. Anti-rheumatic drugs are used, but they are just part of the autocoids system. Therefore, they must be divided. NSAID should have been a separate competency. Since it is not there, we can divide it into a sub-competency and develop SLOs to address the requirement of IMG. pH 1.19, types, doses, side effects, indications, contraindications of drugs on CNS. Again, a very big. All CNS drugs are into one, therefore, they must appear as different components, different classes with different SLOs. 1.21, methanol and ethanol poisoning. Treatment is different, SLOs have to be different. They may be common also, but it will be better if we divide this into two components and develop SLOs. pH 1.25, see, anticoagulants, antiplatelets, fibrinolytic and plasma expanders. Now, plasma expanders conventionally are included in treatment of shock, management of shock. But here they appear in because they go to the blood. So, theme is same, it is the blood. But we have to divide them into subcomponents. So SLOs for fibrinolytics and antiplatelets cannot be same as for plasma expanders. They have to be divided. pH 1.27, antihypertensive drugs and drugs used in shock. So you require separate SLOs for each one of them because the pathogenesis, the manifestations, and drug requirement, treatment requirements entirely different. Therefore, they have to be divided into sub-competencies. pH 1.28, All vascular conditions affecting heart and peripheral blood vessels with a common theme are grouped here. So we have to divide into anti-ischemic drugs or drugs for angina and myocardial infarction, and drugs for peripheral vascular disease. They may not be really same drugs to be used in both these conditions. Obviously, objectives are different, so SLOs have to be different. pH 1.34. All GITs are in one competency, and they must be divided into a number of sub-competencies components with different SLOs. pH 1.36, again diabetes mellitus, thyroid disorder, and osteoporosis as endocrine disorders describe mechanism and all this. Now these must appear as three different competencies because the components are different, objectives are different, and therefore teaching schedules will be entirely in a different teaching learning method. pH 1.37, pituitary hormones and sex hormones again here. So it could have been possible to include pituitary hormones with diabetes, thyroid, osteoporosis, or pituitary hormones could be a separate component or sub-competency. So this must be done. Sex hormones could have been included with contraception. Malaria, Kala-Azar, amoebiasis, and intestinal helminthiasis. Theme is okay. Theme is okay. The only thing is, it will be easier to divide them into subcomponents and develop SLOs and methods. pH 1.48, urinary tract infections, sexually transmitted diseases, and viral diseases, including HIV. HIV is sexually transmitted disease, but all viral diseases may not be sexually transmitted. Therefore, they must be divided. HIV is quite an important subject today, and their SLOs have to be according to the needs required as a core subject. pH 1.6 is the pharmacogenomics and pharmacoeconomics. Genomics would be perhaps drug metabolism. This could have been taken there or developed as a separate competency, sub-competency, and SLOs from pharmacoeconomics. So this is what I thought, that before starting preparing SLOs, we all must understand and realize the way it has to be done. Now, second part is a simple example I have given for a competency which stands alone, doesn't require any integration in pharmacology or minimum integration in pharmacology, and this is how I thought I will make it. It is a core competency requiring certification, knowledge domain, and skill domain, and performance level is the achievement level. Therefore, following steps can be taken in given time. Time required for certification and perfection or proficiency would be 2.5 hours. This is what I think. It can be 2 hours, it can be 3 hours. You can develop your own methods, driving objectives, developing TLM, and developing assessment and assigning marks. So this is how I would be doing. Now this objective is 3.5. I have subdivided into this competency is 3.5. I divided into objectives 3.5.1. Explain P-drug. Point 2 is enumerate steps in identifying a suitable P-drug for given condition. Point 3 is prepare a list of P-drugs for a given condition. Point 4, explain basis of inclusion of each drug in the list. And finally, write that is a performance level independently P-drug for acute migraine, vomiting due to gastritis, or colicky abdominal pain. And this will require repetition, therefore 1.5 hours are given. Now, this TLM can be developed according to the requirement of these competence objectives, and usually a skill session is recommended. 3 times practice is required for proficiency. And TLM method can be developed for assessment, usually logbook, auspice station with a checklist and marks. So this is how a simple P-drug can be developed into objectives, methods, and assessment. Second example which I like to discuss with you is, see, that was a competency 1.21, methanol and ethanol poisoning. I thought it will not be easier to have similar or common SLOs between these two. Therefore, I will divide it. Now, SLOs for ethanol would be identify clinical symptoms and signs. See, this is related, ultimately relates to or have an applicative importance to the IMGA. Interpret blood tests and breath alcohol test. Take suitable general measures and prescribe drug therapy and design a plan for aversion therapy. For methanol, SLOs could be explain importance of early diagnosis and intervention, interpret laboratory data, arrange ophthalmic referral, explain rational use of ethanol in methanol poisoning, and treat acute poisoning by soda bicarb gastric wash, IV fluids and IV soda bicarb, folate, formimazole. There could be one extra, but these two can be combined also. It's not that what I write is okay, but it will be easier for us and for students to learn better about the management of methanol and ethanol separately. So this is all about what I thought that it will be a pre-SLO session to make it easy to prepare SLOs. If you got any questions, you can ask. Hello. Hello.
Hello.
Yes, sir.
Any questions, anyone? Please raise your hands or write in the WhatsApp group. I don't see any hands.
So there is
Dr. Manjunath, they have come. Yes, Dr. Vidya Pandit and Dr. Manjunath, two hands have come.
Hello, good evening, sir.
Yes, yes. Hello, good evening.
Good evening, everybody, sir. Sir, I just had one question. How many SLO, is there any restriction on number of SLOs for a particular competency?
As I personally believe that it should be as less as possible, but there will be there should be good SLO that should point to the desired outcome.
Sir, second part of this question is, should all the SLOs should have this criteria and condition? I have this recurrent doubt, sir.
This has been a very hot topic since morning, and what I would say, just think of the SLO should have an action verb content condition criteria, but every time you are gone writing that under this restrict condition, he has to enumerate 5 conditions, 3 conditions, this. See, now you have to think of the broad-based, what you have to see is applicative use of pharmacology knowledge to the IMG. Okay?
Right, sir.
Instead, that he enumerates 5 drugs in the examination. More important is he must be able to use this knowledge in a given case when he becomes an Indian medical graduate.
Right, sir. That answers my question, sir. Thank you, sir.
Can I make my point here? This is Dr. Tripathi. Hello.
Please.
Go ahead, sir.
Yeah, I think we had a
Last question, how many SLOs and
yes,
etc.
Dr. Vidya Pandit. Dr. Vidya Pandit. Okay. Dr. Vidya Pandit, please unmute yourself. After that, Dr. Madhav Lulu Buchineni, please unmute yourself. Sir.
Go ahead, speak up.
Yes, Dr. Princey, you would like to speak?
Yeah, after they have asked the questions, we will talk. Dr. Shantanu and myself will comment.
Okay. Yes, Dr.
Yeah.
Madhav.
Yes, sir. Sir, good evening, sir, and good evening, one and all. Sir, I have a small doubt. I'm sorry, I joined a bit late, 5 to 10 minutes late. My question is, if take the example of alcohols. In alcohol, there are two different alcohols, ethyl alcohol and methyl alcohol. These two will be sub-competencies. And we have to write SLOs for ethyl alcohol separately and methyl alcohols SLO separately. My question is like, what do you mean by sub-competency in alcohols?
Describe the symptoms and management of methanol poisoning. Describe the symptoms and management of ethanol poisoning.
Sir, ethanol poisoning is one sub-competency. Can we consider it?
Yes, methanol component of this main competency has to be separated. Only then it can be discussed in a different manner. Otherwise,
No, sir,
you have to just treat the common one, and then there will be a lot of the introduction.
Sir, my doubt is like, in alcohol topic, two things are there: ethanol and methanol. Ethanol is considered as a sub-competency. Can we name it as sub-competency?
See, there is third one, ethylene glycol, that can be mentioned in the last in any of the part. What is more important, that here the focus competency is the IMG should be able to treat effectively ethanol poisoning in case he faces a case. Okay.
Yes, sir. Yes, sir.
Yes.
Okay. Now we need
Right,
to
sir. Thank you.
Dr. Vijaya Pandit.
Am I audible?
Yes.
Yes.
Actually, my essential question is like a PH 1.2. It is on evidence-based medicine and therapeutic drug monitoring, and PH 1.8 about drug interactions. Now, are we supposed to take these lectures in the position they have mentioned, or ultimately these competencies should be covered? How is it? Because drug interaction is coming quite early on.
If it is coming quite earlier, then you can club them as a common session. This will avoid redundancy. Fine.
Yeah, may I answer that, sir?
Yes.
Dr. Vidya? Yeah. Hello?
Yes. Yes.
Yeah. So I would say, Dr. Vijaya, your question is really valid because that's what we want to know. And you see the various competencies and it's clubbed up with something, not good partners, you would say, evidence-based medicine, and that should come in, and the other one should come in other section. And it doesn't go with drug interactions, actually. Therapeutic drug monitoring, where you would do usually with therapeutic index when you're teaching in pharmacodynamics. Isn't that the usual way that we used to do it? But my suggestion in making the implementation very rational and sensible, that's what we want to do. We should break these competencies. How was said about clustering of the competencies, clustering of the SLOs, and splitting of the SLOs. Both these have to be done for it to be sensibly handled out. When you talk about evidence-based medicine, you're just going to give a preamble about how the hierarchy of evidence is and what is this treatment, standard treatment guidelines. So you just give a initial preamble to it, and as you teach what is MI, how to treat acute coronary syndrome, how to treat an acute case of malaria, chronic case of malaria, radical cure of malaria. So all that you have to follow the standard treatment guidelines. So you're just giving a view in these initials. So maybe you could club it with nomenclature and all the miscellaneous and put it together as one lecture class. And as you would note, now that you have seen the competencies and now you're deriving the SLOs, it can be sensibly grouped, and you can see you can use the right teaching methodology. So when we go through the aspect of looking at the competency, and that which is given, you can divide into sub-competency for your ease, for your convenience, and then you derive out the SLOs. We can find the teaching methodology. You can see where the integration is necessary. Then according to the SLO, you can also check on the assessment. So everything is interdependent. That is why we have to do it all carefully. And that is why you will be having one primer class was already done. Today's a little more in exhaustive way. Dr. Khilnani has beautifully shown you how you derive the sub-competency and how you bring out all these points of the SLO. Now, again, there will be a session, so you are going to be really grounded. Once you know the SLO objective sets you to teach, and it sets you the assessment. So these are very, very important. Now, right now, at this initial part of this exercise, you would try to make your own from your competencies. How would you like to teach? Just don't think of what others are doing, how you would like your student to learn so that he becomes a doctor that you would like to see when you are sick, like Eli Metnikov has said. So in that context, you decide from here how to cut, how to align, how it would be interesting, how it would be innovative, how it would affect your students' learning. And mainly in education, it is not filling the pot that is more important. It is more important to light the fire. That is what is said about education. So friends, here you're telling about that there are standard treatment guidelines in evidence-based medicine. So they have to know that you have to follow the present tense. Then you are seeing the from where you get the evidence that it's changed the therapy. In fact, our students who are in second professional year, by the time they become interns, they are going to have a different set of guidelines and different drugs coming in. The standard drug that we were talking about now would have changed. So they would have to identify the right drug. That is the reason why you're making your IMG a lifelong learner. Hence, that evidence which we were not teaching in pharmacology up to now is to be added. And that is why evidence-based medicine plays a big role in making our IMGs into lifelong learners. So that's an important part. But again, here, it's just a preamble. It's just, and it would be taken, all the research methodologies, what is attributable risk and all will come when they are learning community medicine. They will also take it up. So the CBME curriculum is based on repeat, repeat, and repeat the most important things. So that's how we will be coming through. So now you have got to know the SLOs. Try working out tonight some SLOs and you can share it with us. The other speakers who will be coming on, they will be also looking at the SLOs that you have done and you can be proud of the work you have done. This is not only just information from this course, it's a hands-on course. We are guiding you. We are all putting our brains together, you and I, all of us together, and we are getting the right way of implementing CBME. That is the whole objective, and that is what we are up to. And you all are on the right track. I'm very glad to see that. And we have very good faculty.
And I would say one or two lines before it is done. Look at PH 1.3, enumerate and identify drug formulation, drug delivery system. Now, someone suggested define dosage form, list out different formulations, identify drug formulation, give an example of administration, enumerate various topical parenteral delivery system, explain the advantage and identify new utility. There are 6 SLOs prepared. I would say for every SLO, please focus last for outcome. IMG. Don't focus this student is learning to appear in examination. For example, number 4. If you were to say number 5, enumerate various oral, topical, parental drug delivery system. It is a SLO. I would have changed it. Select a dosage form for patient with acute headache of asthma. Then similarly, how this can be changed. Identify newer drug delivery devices and their utility is SLO. Probably student learner is preparing for examination. I will say demonstrate proper use of this dosage form. So this is how the focus and outcome is the knowledge and skill IMG has for proper use of these dosage forms. Therefore, whenever you prepare number of SLOs, please keep in mind examination and student is nowhere. It is only learner who is becoming IMG. Thank you.
Yes. Good point, sir. Very good point.
Can I say something?
Please.
Hello?
Yes, please, sir.
Yes.
Yeah. There is some confusion about competencies, sub-competencies, number of SLOs, etc. So first of all,
So please come closer. Your voice is
okay. Is it okay now?
yes.
Yes.
Hello? Yeah. Now, what I was mentioning that we need to clearly understand, because this is a competency-based curriculum, we need to first understand what is meant by competency. Competency is the skill which the IMG must master before he can be certified to act independently as a medical professional. So again, when you talk of the skills relating to what? Relating to his ability to practice medicine independently. That means he needs to, he will be expected to diagnose, to treat, to prevent diseases, and also to communicate effectively, etc., 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 educate patients, all these. So when we are writing these competencies, and the competencies are already have been prescribed. Okay, so far as this subject is concerned, pharmacology competencies have already been prescribed, and you will understand when you look at these competencies also, the prescribed competencies. Here also the action verb is important, because any competency you can think of, it is action oriented. So when you talk of competency, it is related to skill, so it's always action oriented. So activity or action verbs, actually when you write the competency, it starts with that. So I was actually expecting some of you will identify, say, pH 1.7 in this slide, what we can see now, that as opposed to the other competencies, here the action verb is missing. So I was expecting that some of you will identify that and tell. So PV and area reporting systems, unless you use an action verb, okay, it's not really, I'm not convinced that it is a competency. So action verb, you have to identify proper action verb. But then the problem is, as Dr. Khilna has rightly pointed out, some of the competencies as prescribed by the document, curriculum document, is too vast, too wide, too non-specific, because of which it becomes difficult to translate from that competency these SLOs or the specific learning objectives. Now, in the SLO, somebody had also pointed out that whether the condition and criteria, okay, must be there. Ideally, it is why it is expected that because that also helps us to precisely tell or precisely understand what is going to be learned, how the teaching learning approach would be, and then after the learner has learned it, then how it is going to be assessed. If the condition and criteria is specified, it becomes easier for assessment also. So one, it will be helping us to know what we are going to learn. Second, how we are going to learn, and then at the end, whether we have really learned, to assess that. So all this is possible if we can properly. Now, sometimes the competency is so wide and so non-specific, it becomes difficult to break it into SLO directly. So hence there is a reason why Dr. Khilnani has emphasized to break it or split it into sub-competencies. So instead of the broad competency, when you break down into sub-competencies, it becomes more specific, and from that to frame the SLO would be also easier. But whatever we do, we have to keep in mind ultimately, as Dr. Khilnani again has emphasized, the proximate this thing is the examination, but that's not the right, you can say the marker. The real marker is whether the IMG would successfully be able to treat patients or deliver medical care. Okay, so keeping that in mind, you can also understand which particular SLO will be how relevant or how we can prioritize. If there are, say, I don't know, if there are, say, 1000 SLOs, it is quite possible if we really split all the competencies, ultimately the number of SLOs could be maybe 100 and maybe 1000 also. In that case, we have to decide that out of these, which one prioritize it, which one should come first. Again, the question of the core competencies, and which can be uh, which can be non-core competencies, you can split it there also. And this is how you can, and there is a lot of flexibility also. There is no hard and fast rule about breaking the sequence. Yes, you can club competencies also. Okay, competency that has appeared relatively at the earlier phase, along with at a later phase. The other problem, as the course is also temporally progressing, sometimes it may be difficult to really make it more relevant in terms of what is expected from a Indian medical graduate. But then wherever we are spaced in the continuum of the course delivery, we are in the second year starting, and we will be through the second to third year, end of the second year. So whatever is possible during this period, alignment with the other subjects, we have to do that with as much importance as possible, with whatever the students have learned earlier and whatever the students are going to learn later. So the horizontal and vertical integration will continue. So that is how we have to teach. Then only confidence that we can deliver in a proper manner. Okay, thank you.
May I just add to that? When we break the sub-competency, we should also see that you're not taking it at another part. You know, when you push it aside for something, keep in mind also the synchronous. We are synchronous with the other subjects, patho, micro, and pharmac. So when they are taking CVS, we are also taking CVS. When they are taking the pulmonary system, we are taking the same. So when you're clubbing and splitting, you should remember this aspect also. So it should not go ovary. So you have many
That is
things to
alignment.
think. Yeah,
Yeah.
alignment, synchronicity.
Okay, any other question?
No more hands. Yes, Dr. Sangeeta Gupta has raised her hand. Dr. Sangeeta, please unmute yourself. Dr. Sangeeta, can you unmute yourself or write in the WhatsApp group? No, she is unable. So Dr. Kamal cannot join today. He has been posted in a COVID duty today.
Oh.
Okay.
So I just received a call from him that he cannot join. So I think we can. Just a moment. Dr. Kamal, are you there? I think he has joined. Just a moment. Can you unmute yourself, Dr. Kamal? No, it's somebody else, it seems. He has joined from the ward itself, it seems. But he won't be able to present. Let me call him.
So anybody would like to speak on
Anybody would, yes.
Let us invite now questions from. Let us invite comments from the participants on evidence-based medicine. So what is your take on evidence-based medicine and how the same can be discussed with the audience in pharmacology? Let some people come forward, volunteer, and share with us what is your perception and how it should be done. Evidence-based medicine, and you are trying to convey the right message about evidence-based medicine, how it is relevant to teaching learning of
So
pharmacology.
Dr. Monica Jain wants to speak, but perhaps she is unmuted, muted probably.
Who?
Dr. Monica Jain from Jaipur.
Okay, just a moment.
Just a
Monica.
She is unable to contact.
Yes, she's there, yes. Dr.
She
Monica,
wants
please
to.
you are self-muted. Please unmute yourself.
I'm trying to unmute myself. Now I'm unmuted because now you have unmuted me. I was trying for since long to get unmuted. I was not able to do from my side. So good evening, everybody. So I was listening to the. Can you hear me?
Yes.
Yes.
Yes. Good evening, everybody. Everybody of you is doing a great job. So I'm just wanted to know that we are talking about SLOs, we are talking about competency, but I just want to ask one single question: that whenever we are framing a curriculum, we can only write a broad competency there. Whenever we are going to teach, we can keep it in our computer the SLOs. Do we need to mention the SLOs in the box itself where we put the curriculum, or PH 1.62 is enough with a broad topic?
Can I respond?
Yeah, sure.
Can I respond? Yeah. So look, you are having a great role here. Basically, it is the teachers who are actually the main mainstay in delivery of a curriculum. Although there are role of the university, of the institute.
I'm not able to hear you, sir.
Okay.
Please.
Now can you hear me? Now can you hear me now?
Yeah.
Okay. So what I was telling, that the teacher has the most important role in delivery of a curriculum. Although
Right.
there are also the university or your medical college, okay, medical education unit of your college, maybe your department, all are there. But finally, at the front line, it is you and your students. Now, the curriculum document is actually a overall blueprint, how it will be, the teaching learning
Deliver.
will be conducted and the learning objectives will be realized.
Right.
Now, as a teacher, you must be very clear about what are your learning objective in a given teaching
Right.
learning session. So
Right.
unless you frame those SLOs, you are clueless. So framing SLO is very important. Now, how would you frame your SLOs? So your SLOs should also be very relevant. Relevant to what? Relevant to the competencies which are expected, which is desired that the learners would be mastering, okay, would have mastered by the time they are being certified to practice medicine independently. Okay, and that's the reason as a teacher you must know the list of competencies, and
So that is
each
what I want.
competency.
I
Yeah,
just want
that's
to say
let me
one
finish.
thing.
Let me finish.
Yeah. Yeah. Yeah.
For each competency, okay, you have to then transcribe or translate each competency into the SLOs, because it is
Right.
the SLO which will actually help you as a teacher how you will organize your learning session.
Right.
Okay, that is the objective. And the
Right.
SLO, if you frame the SLO properly, appropriately, then it also helps you how much you would tell, what you are going to tell, what is the purpose of telling this and not telling something else. Okay,
Right.
and then after you have told what you wanted to tell, how much the students have learned, telling or making them do what they want, etc., etc. But then at the end, whether they have really learned, you need to also assess that, and that is a part of your formative assessment. Until and unless you are sure that yes, they have learned this much, you have to keep on repeating your learning session. That is the purpose of your formative assessment, and all these will be guided, or all these will be revolving around your SLO. So
Right.
the SLO are to be definitely framed, and the more precise the SLO is, the more easier it would be to play your role as a teacher, to really try to realize those objectives during a teaching learning session, and then also to assess how whether the learner has actually learned to the desirable level what you wanted them to learn.
Right.
So definitely SLOs are very
I
important.
would like
Now the
to
question
add,
is whether at the beginning you have to make all the list ready with yourself, that you
Sir
have
is
to
the
decide at your
yeah,
departmental level. Okay.
right. No, but we have to clearly define the audience. IMJ is at the end of the completing years of MBBS. When we say audience here is second MBBS students. So at an
Right.
Yes.
SLO which we are going to assess should be of that level, that is second MBBS students after completion of second MBBS course or after attending a session should be able to achieve these number of
Yes.
SLOs which can be assessed. You cannot say every time say IMJ. IMJ is at the end of the 4.5 years course that IMJ comes into real practice. Even during internship, you can't say it
No,
is
no,
a
no,
real
no, no,
channel.
no. You have to remember you are actually handling the IMG in the making. So always keep in your mind about the IMG. Otherwise, what will happen? So we will try to make him overlearn pharmacology the way as a pharmacologist we make him to learn. But the moment you remind yourself about the IMG and the IMG competencies, then the whatever you are going to learn will be measured, will be specific, will be precise. Okay, and
I will
depending on
make
what you have. Yes,
small
yes.
comment,
Dr.
sir.
Khilnani, please.
SLOs will be needed. What I perceive is for 5 purposes. Number one, developing a suitable teaching learning method. One. Second, developing or preparing a module which provides a uniform instructions and faculty
Right.
development downstream. Third, these SLOs will be needed for assessment. Fourth, they will be needed for university approval of syllabus as a guiding document for teachers and students. And fifth, as a feedback to the faculty.
Okay, sir. Thank you, sir. Thank you all. Thank you
So,
very much.
Anyone else? Yes, Dr. Danya Pallapalai.
Hello, good evening, sir and madam. This is my
Yeah.
suggestion only because joining this group, actually, I was suggesting that if the participants can take turns in preparing the SLOs for each competency. I've seen one of the posts in which one of the participants has put, and if we deliberate on the SLOs and its teaching learning methods, tasks, and assessments, at least 5 or 10 SLOs in this one up within 10 minutes we can quickly go through, then we would get a better idea. Rather than concentrating more on the theory part, we should get on to the practical part of how the assessment, like as you all said, the competency or the final outcome is very essential. So our teaching, and I really doubt when you're telling that when we have to take care of the final outcome in the basis of an ING, are we really going to put their assessment in that method? Then only there is going to be a sync between what we are teaching and what we are assessing. So my humble request is that the organizers and our faculty should assign some of the competencies to each one of us so that we can make out a final draft which would be feasible and get corrected by the high level faculties in this group. Thank you, sir.
I think we have already shared with you all
Yes.
the topics, and which you have yourself selected. We have not. I mean, you know which topics you have taken. Start making SLOs as soon as we ask for them. Maybe about a week's time. I mean,
Yes.
then we will obviously that is the main purpose we have distributed.
CBME is for this purpose only, Danya, Dr. Danya, and all of us, we are doing it as a hands-on. So first was the primer about SLOs. Today you go a little more into making sub-competency, breaking the tough competency into sub-competencies, and then how you're going to make SLOs. And today's session is ending with a homework for you all to prepare SLOs on any aspect that you would like, and you will share it by mail or WhatsApp with us so that the people who will be taking SLOs is not complete. There is another session coming next Monday. That Dr. Other pharmacology teachers have done, and it will be compared to what you are doing. Okay, so that this is hands-on learning. Okay, we are in it together and together
Okay.
we learn. Okay, so that is why it's already taken care of. And since you have asked, we tell you, you have work or in few days before the end of this week, please submit whatever SLOs you would like in whichever area you
Your
would like.
voice is very low. Please speak closer to mic.
Okay. So in your homework, you have to prepare SLO on any competencies that you would like CNS or general pharma or any. First, how you have written it and what was your idea, and just share it with us. And
Dr. Princey, your voice in a wavy pattern. Some words are audible, some words are not in a sentence.
that's right, not my laptop.
So, are there any further comments, questions?
Sir, yes, sir.
Okay.
Dr. Sangeeta Gupta and Sunita Singh. Dr. Sunita Singh. Please speak, Dr. Sunita. Dr. Rajkumar.
Good evening, sir.
Yeah, good evening.
Hello.
Yes.
Please speak. Good evening.
Everybody. Sir, my question is regarding pH 1.59.
Yes.
So, how we can frame a question regarding herbal medicines?
You have to prepare SLOs, not questions, but
As to the
SLOs. See, what is, in a simple thing, suppose nothing is there. You want to have a session on herbal medicine. What you want to teach them? Why you want to teach them? It should be clear beforehand. And for this clarity, you must have a few selected SLOs for herbal medicine, which an IMG or a proficient doctor must practice or use or understand.
So,
May
because
I
it
comment?
contains a large number of groups are there. There is nutrient supplements are there. There are
There is a
so many
separate,
are available.
nutraceuticals is separate. It's not in herbal. Nutraceutical is a separate competency. It doesn't come in herbal.
Okay.
Can I make a comment here?
But sir, in the FDA, all the nutrient supplements, Ayurvedic medicine, they come under the heading of herbal medicines.
Let us focus on what is there with us. Today, pH 5.9 is herbal medicine. There is another competency on food supplements and nutraceuticals. I don't remember the number, but it is there.
Because sir, FSSI, I consider nutrient supplements and other things are under the one category.
Yes, it is there. It is in one competency. Herbal medicine is separate. Herbal medicine can be medicine. Herbal medicine can be food supplement. You cannot club herbal medicine with a food supplement because it will just, what I personally feel, herbal medicine should be, learner should learn separately.
Right, sir. Right, sir. Thank you, sir. Thank you.
My suggestion about herbal medicine, what Dr. Rajan is saying is, you have to tell the students that there are alternative systems. One aspect is herbal medicine, and you could talk about phytochemicals, phytoceuticals that are coming through. You could just give them a primer. You and I are not competent to teach herbal medicine, but it is just an opener, and you set the stage for them. So this is just a superficial outlook for your student. You should be aware of all. You're making a holistic doctor, right? So that is the reason why he has to know about it. And you will be talking about these parts. Maybe you could act in part about reverse pharmacology. You see? So, what would you like to teach to your student when you're talking about herbal medicine? Yes, and you should not confuse it with food supplements. All food supplements are not from herbal medicine, right?
Right, ma'am.
This is why
Ma'am,
this is how
you have discussed the thing regarding the alternate system along with
we
the
are
allopathic
the right
medicines.
time. Yes.
Thank you, ma'am. Thank you.
Dr. Sangeeta Gupta. She's unable to unmute. Yes, she has unmuted. Yes. Yes, Dr. Sangeeta, please speak. We can't hear you.
Dr. Sunita Singh has sent one query because she is not able to communicate. We were taught to keep SLOs minimum to 4 or 5 if possible, as we have to assess all SLOs. This is her query. And second is, sir, are we supposed to assess each competency or assess after completion of ANS or CVS, for example? She wants system end assessment or the session based assessment. Hello?
Can I respond?
It can be both.
Hello?
Yes,
Yes.
it can be both depending upon you will have to ultimately make sure that the competency is there. I mean, it is your choice. You can do it session based or system based.
Can I make a comment here, Dr. Benny? Hello?
Yes.
Hello? Yeah. So the purpose of having the SLOs we have already discussed. One of the purpose is to facilitate assessment. When you say assessment facilitation, we mean definitely the formative assessment and also the summative assessment. By summative assessment, we mean the university exam or the certifying exam. So where by the time they are leaving pharmacology, we have to ensure that all the competencies that have been identified in the curriculum, they have mastered those competencies, and so they may be certified to have passed in pharmacology. Okay, but then throughout the year, as a teacher, we should also have the obligation to continuously assess them in the formative assessment. And so when we are actually conducting one teaching learning session, whether it is a lecture class or whether learning session or a tutorial or a skills lab or whatever, end of each session there should be ideally of assessment. You may not be able to assess each and every student or in that group,
Voice is not clear.
particularly if it is a lecture class, it's a big lecture class, but then each teacher should also have one component of continuous assessment or feedback, taking feedback from the learners. So this also will stimulate the learner to keep on learning in real time. Okay, if there is confusion, they will come back to us and we should also clear their confusion, etc. But when you talk of post level of assessment, it will be in the what they
There
call
is a lot query. Actually,
am I audible?
Yes, you are audible.
one more query is there, sir, in
Okay,
WhatsApp group.
okay. So I think I have been able to make clarify that why it is important to continuously assess, and also at the end of the course or pharmacology course, and then again at the end when they will be appearing in the final examination. So there is a continuous integration also. Not necessarily pharmacology teacher has to be there to see whether they can write the right prescription, because the medicine teacher can also assess that whether they are able to write a prescription correctly and independently. So that assessment will also be there during the medicine exam, final examination. And the certifying exam is actually a sum of all
Sir,
the
there is a question.
discipline ending examination. Yes, come up with the question. Next question. Okay.
There is a question which I am receiving in this group is that someone feels that each SLO is to be assessed. What I understand is this competency is to be assessed, not SLO.
So basically, finally it is the
Hello.
competency we assess, but then SLOs will help us in the assessment of competency. That's the spirit of it.
Yes.
By setting up the SLOs, it will be difficult to really make an assessment. Okay.
I think we can call it a day. Draw.
Somebody has written again. I think Dr. Khilna had discussed that. Dr. Sunita Singh has written in the group, we were taught to keep SLOs minimum to 4 to 5, if possible. We have to assess all SLOs. 4 to 5 in reference to one learning session that has been mentioned. So that you also you have to mention in the same breath, 4 to 5 in one learning session, so that it becomes easier to deliver that or conduct that learning session. Okay. In one learning session, we should not try to achieve more than 4 or 5 specific learning objective. You are right.
But in one competency, sub-competency, there will be many SLOs and
There
many
will be more.
lectures or
Yes.
So I think we can end it now.
Yes.
I think we should
Dr.
also give
Sharon
them
has asked, can
time
you
to
share
settle.
the template which you said you will be sharing? Yes, I'll be sharing it shortly on the WhatsApp group.
yeah. Thank you.
And also let the participants also settle whatever has been discussed today, and let them also come up with questions in the WhatsApp group.
Yes.
And
They
we'll
have
try to respond. Yeah, we'll try to respond in the WhatsApp group itself.
And they
Yes.
have SLOs homework to be prepared and shared with us so that we can take it up by next Monday.
Yes. Okay. Thank you.
Thank you, everyone. Good night.